Good morning, good afternoon, good evening. I'm Renee-Marie. I'm president and co-founder of the Medical Tourism Association. I want to welcome you to the webcast on WellHotel training and certification for today. I've noticed that the participants registered. We're covering a large span of industries. We've got some embassies, tourism boards, hotels, resorts, both from boutique to big brands, investment firms, even healthcare providers, and some medical tourism associations. So I'm going to try to adapt the presentation to each of your respective industries. I'm also going to be monitoring your questions during this time, and if I can incorporate the answers within my presentation, I'm happy to do so. And then for any of those questions that I'm not able to answer, we can certainly take those questions at the end. As well, we have Olivia Goodwin, who's our Global Program Coordinator for the WellHotel program. She'll also be following up with you following the webcast to provide answers to any questions that you might have. So I'm going to go ahead and get started. I'm sure people will be joining. This webcast is being recorded. So if you need to leave or if you have someone that you'd like to share it with, please feel free to forward it on. The WellHotel Training and Certification Program we developed as a program of the Medical Tourism Association. Essentially, everything that we do with the MTA, we create in furtherance of developing transparency about the quality and pricing of services, and focused on the patient experience through educational programs as well as communication protocols, best practices across the board. So WellHotel was one of those programs that evolved from the creation of our International Patient Services Program in healthcare. And I'll get into sort of the evolution of that in a few minutes. Currently, we have a program that we're doing. It's a pilot project for a destination development program. We noticed that medical tourism as well as wellness tourism has become quite not only a trend, but a niche marketing opportunity. However, many of the destinations that are promoting themselves in the wellness tourism and medical tourism space are utilizing just marketing techniques. And what we found was that it was not as effective in converting health and wellness tourists as it would be for your typical tourism marketing strategy. Currently, we're in the midst, halfway through a 3-year program with Puerto Rico, and as part of that program, we're certifying 47 of their healthcare facilities, 20 hospitality and resort facilities, and 100 professionals in all of the supporting sectors. So this may be travel agents, it may be airport personnel, cruise personnel, and anybody that we see is the touch point in the experience of a health and wellness seeker. Some of the brands in hospitality that we've already certified in Puerto Rico, you'll notice some very large brands as well as boutique facilities. And as I go through the presentation, I'm also going to talk about some of the experiences that we've had in the hospitality sector. We knew that when people are traveling for health and wellness services, they are typically looking for high quality of services. And what that means is that they need transparency. They know that they are looking for a healthcare procedure or they're looking for something to improve their lifestyle, enhance their lifestyle, and in some cases, change their lifestyles completely. In order to do so, they need to know what's being offered, and they also need to know how that is going to affect their lives moving forward, which is the care continuum. So if a health and wellness seeker is going to a health center, whether it's a clinic or a spa that has aesthetic procedures, or just a lifestyle changing facility to learn how to improve their lives and focused on prevention or lifestyle maintenance, they need to know how is that going to impact them over the long term, what's going to be available to them. If they're spending 2 to 3 weeks in a particular destination to achieve these goals, they want to know that the facility that they're staying at understands the special needs for them as a traveling health and wellness seeker. which may be much different than your typical tourist or much different than your local patient if you're a healthcare provider. So we looked at where some of the gaps are and what some of the needs from the hospitality sector were. Currently, we found that a lot of hotels and resorts did not know how to communicate with healthcare providers or health centers. They also found it challenging to communicate with the health and wellness seeker. So the program was designed to improve communication protocols, establish best practices, and look at streamlining all of the processes to the point where you're essentially creating a new profit center within your facility that's really focused on the entire experience of the health and wellness seeker. That means all of the staff understand the culture of wellness, and they're communicating at all of the touch points of that experience, wellness communications. They're helping you grow your program by being a part of it. As many of you know, and there's some statistics on this slide here, wellness travel is estimated at over 586 million domestic and international trips. They typically, medical tourists, for instance, will spend 5 to 10 times the amount in the local economy, and international wellness tourists spend about 59% more on a trip, and domestic medical travelers spend 159% more on a trip. Some of the destinations that are starting to brand themselves as a health and wellness destination recognize that the true niche and the true ability to communicate an attractive destination will be to create a bridge between the healthcare sector and the hospitality sector. So we see WellHotel as that bridge. We see it as an opportunity for the hospitality sector to understand the special needs of a traveling health and wellness seeker, and we see it as an opportunity for the healthcare sector to understand how hospitality and hospitality protocols need to be integrated into the offering for patients. We designed the WellHotel certification, as I mentioned, as an extension of our healthcare training and certification. We found that there was a gap. When we followed a patient, it was actually a medical tourist. They were looking to get a double knee replacement in Costa Rica. And they had a fantastic opportunity to get this knee replacement done that was going to change their whole lives. This particular patient, he was a tiler for a living. He laid tile flooring, and having being encumbered with his knee problem, he was unable to actually conduct his day-to-day business. So it was really critical that he got these procedures done. And in his case, he was underinsured. So we followed him and did a documentary called Angels Overseas. What we found during the 3 weeks during that trip is he had an excellent experience in the healthcare sector. But what transpired was when he recuperated in the hotel, that hotel had not implemented any program for its staff to truly understand the needs of that recuperating patient. Meaning he had just had a double knee replacement, and so he actually was bedbound for the majority of time. He was receiving physical therapy on a daily basis. He was not able to go down to the buffet in the morning and walk around the areas, the outdoor areas. He was not able to maneuver the staircases. And really, so his entire event, his recuperation, was spent in this hotel recuperating. So you can imagine he really needed to be able to not only be entertained, he needed to know that the pricing of his services were going to be acceptable, and that during his trip he was going to have privacy. But we also needed to establish the protocols for the staffing. For instance, he did not want to be interrupted first thing in the morning. He wanted to sleep in the morning. So there was a lot of things that needed to be considered. And when he left that experience, the only thing negative he talked about was the recuperation in the hotel. So this experience that I'm describing to you is a medical tourism experience, but it happens all the time. The hospitals oftentimes will keep patients in their hospital rooms longer than medically necessary because they don't have hospitality partners for that patient to recuperate in their facilities. So there really was a need for hotels that were interested in working with recuperating patients. Additionally, we found that many of the hotels and resorts that are involved in lifestyle change, they have educational programs, they're looking to attract health and wellness seekers from around the world. They don't necessarily how to communicate this need, and they saw the medical tourism and wellness tourism industry as a way to promote themselves. But what happens when that health and wellness seeker then returns home? The care continuum and the protocols in communicating with that patient were not as developed as they could be in order to maximize word of mouth referral and also to create greater visibility in the medical tourism and wellness tourism space. So we also work with facilities that are focused on lifestyle change. Then we look at the business traveler, or we look at the typical tourist who's looking to either maintain their existing lifestyle, create a new lifestyle. They're a business traveler that wants to be healthy, or they're a meeting planner that actually wants to organize healthy meetings for their attendees, which helps them, of course, live their lifestyle better. So we looked at the different ways that we could create a care continuum for the health and wellness seeker that spans from simple healthy menus and spas through the more what we call level 3 facilities that are looking at working with healthcare providers for lifestyle change and also recuperation. Things like executive checks, for instance, or aesthetics, cosmetic procedures, and even more advanced for recuperating cardiovascular patients or patients that are there for a long period of time for oncology treatments. The Medical Tourism Association basically has collected through the years, through surveys, interviews, working with healthcare providers around the world on all continents, a series of best practices. So when we took the International Patient Standards, the IPS training and certification program, and we worked with hospitality experts from all over the world, we identified best practices and standards that would be able to apply to any facility. As I said, whether it's a boutique hotel or a large brand, or whether it's rental properties that are looking to provide long-term stay for recuperating patients or their families. And we found that almost all patients or health and wellness seekers are traveling with at least one companion, and in many cases, depending on where they are coming from in the world, many of them come with large groups of family members as well as friends. The health and wellness industry is, I'm going to use it interchangeably with medical tourism because I believe you are seeking the same audience. I think there's people that are looking for medical interventions, and I think those same people are looking for recuperation. They're also looking for prevention, executive checks, diagnostic evaluation, dental care, cosmetics, things that are non-invasive, but also spending a longer period of time. So we look at some of these aspects as shown on the slide, looking at mind, body, soul, the spiritual, the psychological, emotional, and the physical aspects of a potential health and wellness seeker as our targets. So as I mentioned, there's a lot of different people who are on this call that represent these industries. We have people even from airports that are on the call. So we're understanding that each touch point along the experience of the health and wellness seeker, from when they land on your website till well after they return home, becomes part of that care continuum, and that's what truly is going to enhance word of mouth referral and also referral from corporate, what we call corporate buyers. These may be travel agents, they may be medical tourism facilitators, wellness tourism facilitators, employers, self-funded employers that are contracting with healthcare providers as well as contracting directly with hotels for the recuperation of their employees. So there's a much larger opportunity in this space than just your traditional business-to-consumer marketing. I mentioned some of the clientele, the wellness traveler, business traveler, recuperating patient, and those seeking lifestyle change. And really, it's going to be up to each facility to determine, one, what is their risk management profile? What are they interested in acquiring? And what type of capacity do they have to serve a particular clientele? Do they have a high season and a low season?
Medical tourism and wellness tourism do not know seasonal activities. People are traveling for these services throughout the year. So it's a very good opportunity to create new business in some of those low season times. These types of services you'll see on this slide cover the entire gamut of wellness. So some of these you may offer, some of these you could offer, and some of these are even offered by health centers and facilities that you could partner with. So don't think of this as in terms of something that you need to invest in. What we highly recommend is looking at the services that you have and how do you create a better operational management structure for them so that you're truly optimizing them, creating better profit centers for rolling them out to perhaps a new audience and a new distribution channel that are truly looking for these types of services. It allows you to create new partnerships with healthcare providers as well, should you wish to work with them for things like executive checks and, of course, surgical recuperation. Some of the hotels and resorts that we worked with are very small. We even work with lifestyle change facilities that only have 9 or 10 rooms, and then others that have created designated floors or designated rooms specifically for a recuperating patient or for a wellness traveler. And within those rooms, it has special menus and special services so that they understand they can phase up their particular program if and when they're ready. So you can look at just creating a small pilot project within your existing facility with the services that you have, and then communicating those services and communicating that program to a new demographic through the wellness tourism and medical tourism space. But I think the key point and what we look at when I get into the program for WellHotel training and certification is that it is critical to get the culture of engagement established amongst your staff. Meaning it's not good enough to be just putting a menu in a room. If your staff isn't talking about wellness, if they are not making well recommendations, if you're having meetings that don't have healthy options, that truly is not the culture of engagement of wellness that's going to be attractive to meeting planners who are making that a requirement in some cases, associations that are focused on wellness, health, and prevention, and other types of fitness and nutrition organizations that your facility could be attractive for those types of meetings. So we summarized here some of the benefits of WellHotel training. As I said, we look at the entire continuum. A training, for instance, we'll work with the managers, we'll work with the staff, and we will establish through champion training a higher level for the managers to be able to maintain that culture of engagement within their facility. So any staff turnover, any new staff, any expansion, that can be resolved internally. It's a sustainable program. And as you know, probably from your own lives, everybody is looking to improve the quality of their life. Through medical advances, we're living longer, we want to look better, we want to feel better, we know what's good for us. And so it's really critical that if we're traveling for whatever reason, that we have options and that the hospitality sector is providing those options to help us improve our lifestyle, regardless of why we're there. Every WellHotel certified facility is also becomes a Medical Tourism Association member. We have a 2-year membership as part of the certification. There's a summary of the benefits here, but really what we're doing is we're creating visibility and new distribution channels. There are not a lot of hotels and resorts that are currently promoting themselves in this space. They're promoting themselves in wellness tourism, but they're typically doing their promotion and marketing through tourism channels, which of course is beneficial, but this is a new opportunity to access a new market of people that are really looking specifically for lifestyle change and recuperation, in addition to travel agents and facilitators that are focused exclusively in wellness travel. We have Medical Tourism Magazine, and we also have Wellness Tourism Magazine. We create visibility for all of our members. We create connectivity and networking opportunities, and also case studies and interviews, as well as speaking opportunities and prioritization for our events. So it's definitely more value than even using just the seal and having your staff trained, is really accessing new sources of distribution. We have a partnership with the International Luxury Hotel Association. So for those properties that are deemed luxury properties, ILHA is actually the largest influencer in social media in the hospitality and travel space. There's some information here about them, but they are in the top 100 of the 2 million groups that are currently on LinkedIn. And through this partnership, we are able to really adapt our program for the luxury market and create new distribution channels through their network for the luxury properties that are also WellHotel certified. On our WellHotelcertification.com website, we have listed all of our certified properties, and as I said, we look at everything as a partnership. So we want to make sure that that you are getting the visibility, but also we want to make sure that if and when you are ready to make that step to partner with healthcare facilities, we can connect you with that. So right now we're working with a lot of facilities that are already in partnership with the healthcare centers, and they're saying, hey, we need them to work with us to provide additional services that will help support the recuperating of our patients. So that connectivity is important. It doesn't require a lot of investment to promote the services that you already have in the right way to health and wellness seekers. ILHA also has the Luxury Hoteliers magazine, so we're also able to create membership and visibility in the luxury travel space for those properties that qualify. So getting into the meat of it, we currently have 12 categories of the WellHotel certification program, and within those categories, there's 104 standards. So if you look at the summary here on what we call the tree of life, we're looking at everything from the physical environment to the communication channels, looking at how you measure quality improvement, sustainability factors, cultural competency, which is something that I haven't mentioned at this point. Many facilities, they recognize that there's a great opportunity in particular demographic markets, those cash-paying people that are seeking health and wellness services. However, they don't necessarily have a culturally appropriate services to receive those targets. So in looking at your strategy, you want to make sure that your strategy matches your services. And I'm not telling you anything you don't know, but that's what we look at when we are looking at the certification standards and we're evaluating your model to those standards. We're able through the training program to identify some of the gaps in delivering those services currently by working with interactive training program with your staff and with your management, and we provide a recommendation for areas of improvement. Even if you have met the qualifications for certification, we will provide recommendations for areas of improvement so that you can look at achieving 100% would be the goal. We have currently 3 levels of certification, and the reason we established this was threefold. For the first reason was no facility is exactly alike. We also work, for instance, with hospitality investment groups, and we work with healthcare investment groups. There are many healthcare providers that are looking to partner with hospitality brands to build facilities adjacent to their healthcare center or built in, where they create a boutique style facility or to piggyback a campus in a medical tourism city or wellness travel city. And in doing that, we evaluated that not all of them wanted to deal with recuperating patients, and then not all facilities had the budget to be able to invest to that level or to be able to build out services beyond their existing healthy menus, healthy options, and perhaps fitness activities at their gym. So we created 3 levels. You see the differences between the 3 levels. Level 3 is obviously what I see as the goal, because you're talking about a 10-hour training course with the staff and the management, and the idea is to build that culture in the program. But those that start at level 1 can also move to and convert to level 3 if and when they're ready. The idea here being that we want to grow with you, that no facility is alike, and when we look at a level 3 training opportunity, we're really looking at the existing culture of your facility, your brand, what you have done. We're analyzing that, and we're preparing and customizing the training program to really fit where you are today and where you'd like to be tomorrow. The investment in WellHotel, as I said, there's a cost for training and certification, but we're not expecting you to build something that you don't already have. We really want to look at what you have now and how you anticipate growing that program in the future. If you have a concierge now that is communicating wellness activities, fitness activities, that's great. But the goal would be to have all of your staffing talking about that, asking clients if they're here for a wellness trip, triggering in their mind that maybe they should be considering it. And what does that produce? It really will boost up your profit margins in the programs that you have already and really become a more attractive destination for that. And also develop new partnerships with healthcare facilities that you may want to partner with. We have developed certified wellness travel professionals. Some of you may be familiar with our program called Certified Medical Tourism Professional. And that program is really tailored towards anyone in the industry that is interested in working with medical tourism, recuperating patients or traveling patients and health and wellness seekers. In recognizing that the hospitality and travel sector, many of those were not interested in working with healthcare facilities, but they wanted to really hone in on this lifestyle change market and the health wellness seeker, we created CWTP, which is focused on hospitality and travel professionals. So if you're working for a facility that doesn't already have a program, or a facility that perhaps is not ready to invest in training and certification, I would recommend the CWTP. It's something that we're offering at our conference in September in Washington, D.C., September 25th through the 28th. It will be adjacent to the International Luxury Hotel Association meeting, as well as the World Medical Tourism and Global Healthcare Congress. That's an opportunity for you to take it live, which I highly recommend, but it will also be available online. And then additionally, if you have several staff that you'd like to train, but the hotel or resort is not ready to take the step towards certification because perhaps they're developing the program or they have in their business plan some sort of future plan, then some of your employees getting CWTP certified, they would serve as an ambassador for the program, and it would be beneficial to do. And so we can come into your facility and we can train staff for that program. And also, if you represent CVB or group initiatives, if you're a medical tourism association, or you represent a group of a branch group or a group of hotels and resorts, we can also do a CWTP live for across your chain, and we can streamline it to your different facilities. This is a summary of what I just told you, the different ways that you'll be able to access CWTP. CWTP won't be available online until after our September conference, where it will be recorded. It's in Washington, D.C., so for those of you who want to join, please take advantage of that because it is interactive. So most of the time we have this question, how is this going to increase my business? How am I going to put more heads in beds? How am I going to fill my low season? We see again that health and wellness, spa services, and most of the healthy option programs within hotels and resorts are not a dedicated profit center. So we're looking at really creating greater levels of efficiency and operational management structure for this program as its own profit center. So you'll find that having your staff, as I mentioned, very, very engaged in this process is going to improve your lead conversion. It's going to improve your marketing communications, whether that's through your traditional tourism marketing that you're doing or now your new added access into either ILHA's distribution or medical tourism associations distribution channels. You'll be able to communicate better across all sectors your value proposition in the industry. You can create new partners with health centers, even for things that are non-invasive whatsoever, such as aesthetics or executive checks, where people are coming for 1 or 2 days, they're waiting for blood work to be done, and they're otherwise engaged in healthy activities. It's also going to be instrumental moving forward. The research that we've done on medical meetings shows that medical meetings, fitness, nutrition meetings, they want a healthy destination to go to. So the more pronounced and the more profound your program becomes in the way that you communicate that to meeting planners and DMOs, I think will be very, very helpful in expanding that model. And medical meetings as well, health meetings, fitness meetings, all of these meetings and really any meetings across the board, people are looking to have healthier destinations, and those also are not seasonal. You'll receive the logo to be able to use on your website and your marketing materials. And for those of you that are very familiar with the Medical Tourism Association, you know we do a great job at marketing and promoting, focused on our members, and really trying to work with the media to shine a light on the need for this care continuum, the bridge between healthcare and hospitality services. These are some of the areas. We have a 1.5 million distribution channel. We actually manage one of the largest travel groups in addition to LinkedIn groups for medical tourism, for wellness, our partnership with ILHA, our magazine. We have Medical Tourism City, which is a network that you could log on to. It costs nothing. It's like LinkedIn, but it's a communication and exchange board for a social media platform for the medical tourism industry. We have Medical Tourism Magazine and Wellness Tourism Magazine, and these benefits that you'll see here are ways that we promote certification of your facility. So WellHotel certification site will become soon an interactive site where you'll be able to post case studies, testimonies, and different things that are going on with your facility that are involved in health and wellness seeker travel. So that's a summary of what we have for the WellHotel certification program. I'm happy to take questions from anyone. I do see that someone is asking about the maintenance of certification. Right now, we have an annual reporting requirement, which really you're reporting your KPI, your key performance indicators. That is an indication that you're maintaining the standards. And at the end of certification, you would submit an update form, which would essentially provide for any changes to your program, any additions or any deletions, so that we can do a reevaluation to assure that you're still meeting the standards. I think one of the key points people look at is, well, for a 2-year certification, how do I know that I'm getting my benefits? You will have a membership coordinator here at the Medical Tourism Association, and we also have Olivia Goodwin, who is our wellness WellHotel coordinator, and she will be working with you to assure that all of your benefits are met, that we understand your needs, and that we can create maximum opportunities for you. We do work in different areas of the world. We have 15 regional offices and representatives, so if there's a certain part of the world that you're interested in attracting health and wellness seekers from, we can work with you to focus your target market efforts. We also organize trade missions around the world. These may be CMTP or CWTP workshops, and our certified members, we invite them to participate in these. So if you can imagine that we're working with certain types of emerging markets, I'll give you an example in the Caribbean, where we're organizing a CWTP or CMTP workshop. It'll give you the opportunity to actually come and participate and meet those travel agents or referring physicians or groups that may be referring health and wellness seekers from their destination out. So it allows you an opportunity for networking. We also have a China conference that's coming up June 3rd through the 5th. So for those hotels and resorts that may be interested in expanding, looking at new investment opportunities where many areas, the Chinese market's very interesting because many areas of government as well as the private sector are looking to bring brands into certain parts of China in what's called medical tourism cities or health tourism cities. So coming to the table with something like your brand with aligned with ours, with the WellHotel brand, will be a very attractive opportunity for them as well. And we have an Abu Dhabi conference that is coming up in November. It's at the end of November, 25th, and the Middle East and GCC region is one of the largest target markets in medical tourism because of the length of time that they tend to stay where they're recuperating, or those that are coming for lifestyle change, and they're looking for privacy. So they may be looking for executive checks and to change their lifestyle, but they want to get away from their environment. So many of them come into the U.S., they go to Europe, they go to Asia, and even different parts of South America. So that's another opportunity to think about. And then if anybody has any particular questions about the program, my contact information is here. Olivia's contact information is here, and then the webcast itself will be available within about 48 hours, and that if you wanted to share it with any of your staff or any of your partner facilities, I highly recommend it. We really felt that WellHotel is the bridge in supporting wellness tourism and medical tourism. We think that as corporate wellness begins to rise, as the understanding of wellness and healthy living continues to grow, it's a fantastic opportunity to see where you fit into that picture, how you can really allow your services that you have now to shine and access new distribution channels. So I think that I've covered everything so far within the presentation. I'd like to thank everybody for their time, and I wish you a very good morning, good afternoon, or good evening. Thanks so much.